Hello, Dr. Muhammad Omar Al-Farouk. Nice to meet you. I am Muhammad Mazhar Ashur, one of MRCS course instructors. I'd love to ask you a little question about our last wave at Vascular Art Center. What are the common mistakes candidates fail of or show at our last wave? Thank you, Doctor.
Thank you very much, Mr. Muhammad. It's a very good question. One of the common mistakes that I have seen with candidates is with excision of neighbors. So if you look at this scenario, I will point out here, we usually give you a scenario where there is a plastic sheet on the thigh of the patient and we put a circle on it with a marker like this. This is neighbors. And we tell you in the scenario that there is a local anesthesia has been given. So number one, you need to plus mention to the patient the procedure, it checks the consent form, it checks the rubber band of the patient. You need to check the local anesthesia is working. And this, I was surprised, some of the candidates have used the knife. If you use knife, you lose a lot of marks, if not failed, because you don't test the sensation by knife. And some have used the mosquito and they try to clinch the plastic. This is another way of damaging the skin. The only tool that you should use, not even a tooth de forceps, a non-tooth de forceps, and you mention to the patient, can you feel this or not? This is very common mistakes that we see. Secondly, we give you a roller like this one in centimeter. Most of the candidate does not use the roller at all. They don't know what to do. So here, what you need to do, if this was in the thigh, and you need to make with Langer's line is parallel to this line, longitudinal, so you need to have longitudinal excision of the ellipse. So what you need to do is to measure 1 millimeter, here it is, and you measure 1 millimeter as a safe margin, and you put a point. Another millimeter as a safe margin, and you put a point. And then you measure the distance between this point and that point. It is 7 millimeter. So the transverse diameter is 1/3 of the longitudinal diameter. So you need to have 21, which will be from this point up to this point, is 21 millimeter. So here you have not just a 4 point, but you need to put a dotted line that this is your excision. A dotted line, this is your excision. Some of you does not do measurement at all, which is wrong. And when they do measurement, they don't know how to do measurement. This is how measurement is done. And then you hold the knife in a pencil grip. This is the grip you hold it. There is a palmed grip when we do an abdominal incision, but there is a pencil grip. You hold it as if you're holding a pencil. And then you don't need a hesitation mark. You don't need to make it multiple times. You need to go in, thickness maybe 1 or 2 millimeter, and have the ellipse shaped in order to do excision. One of the other mistakes is that you do undermining of the skin. This is wrong because we provide you with a plastic sheet. This plastic sheet is not made out of layer. So even if you do undermining, it wouldn't pull the skin toward each other. This is very important. And when you start suturing, you start from one edge, either this way or that way, and you will be asked in the middle of the scenario, how many stitches? What I like you to do is, while you are working on the suturing, that you can speak to the patient. You don't interrupt your work to reply to the patient, and then you go back to your work again, because we judge how you are doing multitasking. And then you get a question, what shall I do for dressing and antibiotic and so on. So these, I found one of the common mistakes. Some of you are either inexperienced with excision of nevus, or this is not the routine practice they do in the hospital. And you are always judged by the practice in United Kingdom. And this is one of the common mistakes. And thank you very much, Mr. Muhammad, for asking me this question. And I hope in the future they all avoid this mistake. Thank you very much.
Thank you, doctor.